This may not be your average commute to the hospital, but for University of Nevada, Reno, Orvis School of Nursing students Rebecca Gansberg and Davy Serafini, this has become their everyday. That's because the Orvis School of Nursing launched its Office for Global Engagement in 2024. And now students are learning and teaching at Sonia Kil Memorial Nonprofit Hospital in the rural town of Kampot in southern Cambodia.
One of the key things that we wanted was to not have this be a volunteerism process where the environment is set up for the visitors. So this is a hospital that runs 24/7, 365 days a year. They welcome visitors in. They limit how many of them come in or volunteers come in. And so finding a place like this, it's a needle in a haystack, honestly.
For years, Sonia Kil Memorial Hospital has been welcoming volunteers from around the world to come learn as well as teach.
So in a year, I have around 40 to 50 people come to get the intern or volunteering. So half of them is the expert and half of them are the student.
In addition to being there and working alongside their Cambodian colleagues, each of our students is doing at least 2 different presentations for the nursing and or professional staff. So they do one that's clinically focused and one that's leadership focused.
Rebecca Gansberg and Davy Serafini are both in their final semesters of the nurse practitioner program. They are practicing nurses, bringing with them years of experience. And both students are completing 100 hours on site, rotating through wards, joining rounds, and working alongside Cambodian providers.
It's been equally like us and the providers here bounce ideas off of each other, which is great. They help us learn, we help them.
The way that they assess patients here, it's great. It's like if you didn't have anything but your eyes and your ears, not even a stethoscope, just how the patient looks, which is great. We rely a lot on technology.
100%.
Yeah.
Learning how nursing is being practiced in a different country helps broaden your perspective. And in the same way, it will also give you that sense of gratitude. Like there are a lot of things that you have in the States, but we don't have in here. But we're still functioning and can do, that with the things that we are given. So I would highly recommend, for a student to come here and experience that and be out of, the comfort zone.
The way we would treat patients in the States, we don't even think about doing A, B, and C. We just do it because they came in and this is what we need to do. Here, it seems they know this patient needs this, but what is the best use of resources? Do we need to use this for this patient? It's not just like a given, oh, we're gonna do it.
Times when people come from, especially first world, would come to a third world, they will be in shock. They will be in shock. And then, oh, this is like, nursing in third world country, which is good. But it creates a creativity in you in how you approach, things or beyond your comfort zone.
They're also very patient-centered, which we try to be, but here in a very different sense as far as resources and financial strain go. We don't consider the financial aspect very often. Here it's very much like you ask before you do anything. And if a patient denies most of the diagnostics, they do what they can for the patient with the information they have, which I think is great.
These global perspectives show students and providers alike that there are many different roles and approaches to nursing.
Because we're used to a certain way of doing things, we have kind of a one-track mind when it comes to it. So we think there is only one way to do it. You must have these supplies, you must run these tests. And what we see here is that there's a lot more to healthcare than that. So we learn that there's a different way of doing things.
The hospital is set up in a way that encourages time outside in the open air, In addition to having lotus ponds and a spiritual shrine on site, the wards are separated by outdoor covered walkways. And although this open-air hospital may look different and be halfway around the world, there are more commonalities than differences.
The issues that we face are the same issues that we face in the US. We can learn how they handle them here and see if those are things that apply to us, just as we can share how we handle them and they can see if it applies to them. Rural healthcare is the same no matter where you go. We have issues of access to care, financial ability to pay, and lack of resources in the area. And just like in the US, like in Nevada, some of our rural hospitals have docs who come in or providers who come in 1 day a week, 1 day a month. It's the same thing here. So again, how do they handle it? How do we handle it? What can we learn from both to get the best answers?
The students not only work alongside their Cambodian colleagues, but also with international volunteers and students. Sarah Louten is a nursing student from the Netherlands. She is doing a 3-month volunteer internship here at the hospital.
You meet a lot of doctors who are from like different countries. I met a lot from the USA, but also an OBGYN from Norway, and they all have different takes on healthcare and how they do it in their country. So you learn a lot from that too, even while we're in Cambodia.
Sarah is finishing her last year of nursing school back in the Netherlands, but what she has learned here will stay with her as she begins her career.
I was just standing in my little corner watching, and the mother had some issues. It didn't go well. It didn't go good, so I have to, like the doctors winged me over, and I had to hold like a leg and push and help the woman, give birth to her baby. So I was just standing there with a leg, and the baby was here, and it was just really amazing. Then I get to help to take care of the baby and just cleaning it up and making sure it was okay. So that was really beautiful, and I will never forget it.
Trips like this have the potential to change the trajectory of providers' careers.
It's just really amazing to see how people in other areas of the world live day to day outside of the hospital. And it's interesting to see kind of how it all ties in together. It's just been a really awesome experience to, ride into the hospital every day and see how people are living. The staff here has been incredibly kind and welcoming to us and have taken us out to eat and showed us around, showed us more like traditional Khmer stuff. It's just been great.
This trip has helped me solidify. I know that I want to continue to be able to do these trips and use my little knowledge that I have as a provider, hopefully in the future, to do short trips like this or maybe even longer trips, but definitely keeping it a part of my practice.
We learn from them and they learn from us. They come not only one time. So I have many people around at the back. You see the picture? So all of them, they not only come for one time, just one time, and then the next year they make the plan to come back every year. So I've been here for 11 years, so I meet them every year.
But this is just the beginning. The Orvis School of Nursing Office for Global Engagement has just begun its journey, and more trips hold the promise of connecting people and perspectives from across the world.